Hello, my name is Leland Lemons. I am conducting my oral presentation for Bio 54, and my master topic is reproductive cancers. The definition of reproductive cancer it is a reproductive organ that's found in men and women. The main reproductive cancer in women are breast and cervical cancers. The main reproductive cancer in men are testicular and prostate. The first cancer that I will discuss with you today is prostate cancer. Prostate cancer is a cancer that's found in the prostate in men. Over 150,000 men was diagnosed with prostate cancer in 2018. And who gets prostate cancer is most common found in older and younger men, and is more likely to occur in middle-aged men and African American men. Out of 100,000 men, 125 men will be diagnosed with prostate cancer. Some treatment options for prostate cancer are surgery, chemotherapy, and bone directed treatment. Some side effects of the treatment options for prostate cancer are nausea, fatigue, and vomiting. Researchers have found that brachytherapy has helped has have been found to help prostate cancers patients to reduce some side effects of radiation treatment. The next cancer I will discuss is testicular cancer. Testicular cancer manifests in the scrotum of men. Over 20,000 men were diagnosed with testicular cancer last year. The number of new cases of testicular cancer was out of 100,000 men, 8. So out of 100,000 men, 8 men were diagnosed with testicular cancer, which is a very low rate. In 2014, over 300,000 men were living with testicular cancer. And some symptoms of the testicular cancer are steady weight loss, swelling of the scrotum, and lumps and sharp pains in the testes. Um, some ways to check for testicular cancer, which is one cancer that can be checked for, is taking your fingertips and rolling them across your scrotum to see if you have any hard, very hard, or sharp pain in the scrotum or ball-like filling in the scrotum. And if so, contact a medical assistant as soon as possible to make an appointment for that. Because like the rest of cancers, if you catch testicular cancer at a in the early stages, then it's very treatable and is at a very low rate. So it's something that can definitely be taken care of. The next cancer is ovarian cancer. Ovarian cancer is found in women's ovaries and is the fifth leading cause of death in women. The ovaries are where the eggs are stored to start human life. Um, some things about ovarian cancer. About 25,000 women will receive a diagnosis of ovarian cancer this year, and over 15,000 women will die from ovarian cancer. There's a 1 in 80, out of 80 women, one woman will have ovarian cancer, so that's a very low risk cancer. Ovarian cancer is usually found in older women of 63 years of older, 63 years of age of older, and is more common found in white women and African American women. Some other things to go over with ovarian cancer is the symptoms. Some symptoms are abdominal pain, upset stomach, frequent urine, and swelling of the abdomen, which is really that's really in the late stages of the swelling of the abdomen, from what I read. Treatments are biopsy. Um, Worst case scenario, have the ovaries and cervix removed, and of course, chemotherapy. Some current news about ovarian cancer is researchers have discovered gene mutations in the BRCA1 and BRCA2 that is helping women make a better decision on able to remove their fallopian tubes or ovaries in an earlier stage. Lastly, is cervical cancer. Cervical cancer is located in the uterus and is connected to the vagina. Cervical cancer cells are found in or around the cervix, um, and it is caused by STD, unlike any other cancers, I believe. H by and the way you catch, are you can be diagnosed with cervical cancer is contracting human papillomavirus, which is long term for HP, short term is HPV. Some symptoms are usual pain during sex, usual discharge of blood. Um, the death rate from cervical cancer in the U.S. is high among African American women. They found about 75% of patients that's over the age of, I believe, 70 is African American women, which is very disturbing. Um, Researchers also found that women are, of course, at higher risk. Black women are, of course, higher risk of being diagnosed with cervical cancer, and over 46% died of cervical cancer. Um, Last year, over 13,000 women were diagnosed with cervical cancer, and 5,000 women are expected to die from cervical cancer. Some treatment options are hysterectomy, laser surgery, and cryosurgery. Researchers have concluded that not all HPV can cause cervical cancer, so that's a good thing. Some things to stay away from, or ways to not be diagnosed with cervical cancer, is stay away with a partner that's had sex with multiple partners, um, a partner that has HPV, and of course having protected sex. Out of the research that I've done for the cancers, these reproductive cancers, I found that if you feel any of these symptoms, even the slightest symptom, you should get tested as soon as possible, because cancer can be put in remission or reversed or taken out if it's found at an early stage. Usually, um, most patients that die from cancer, they's usually found in the later stages, in the fourth stage, and the cancer has spread to the bone, and it's nothing that the medical team can really do for that patient besides comfort them. Um, so that's all, and thank you for your time.
Where is it? I don't hear it. No, I didn't hit record.